In medicine, it's impossible to treat and save every patient. If you're a doctor, there may come a time when you will have to tell your patient that the treatment is no longer working and they're dying. And when that time comes, you do not want to get it wrong. In this video, I'll teach you how I approach this difficult conversation. Over the years, I've had to navigate these difficult conversations numerous times, and I've been fortunate to be regarded as one of the better doctors when it comes to handling these sensitive conversations with patients and families. My name is Sal. I'm a double board certified doctor, specializing both in kidneys as well as intensive care, and based in the United Kingdom. And I created this channel so as to share my experiences and lessons in topics that I think are not very well covered in medical school or in medical training. First, I want to cover 2 points when it comes to delivering bad news. Even after years of practice delivering devastating news to patients and families, I still do not find it easy to do. And that comes to my first point. It's unnatural. Going up to another human being and telling them that they're dying is not natural and not normal for anyone to do. And it is an incredibly difficult and emotional situation. And my second point is to not watch this video and expect to have a script that you can replicate for every patient. Every patient is different. Their background, illness, their beliefs, their understanding of the situation. And you have to adapt your approach and conversation based on these factors for every patient. However, the broad principles of how you structure and approach a conversation remains the same, and I'll go through these just now. Now, there are various aspects on how to break a bad news that I think are quite well taught in medical school. Things like setting up the scene, making sure that you're in a quiet room, making sure that you don't have a bleep or phones that can interrupt your conversations, and various things that I think are quite well taught, and I won't go through these topics in this video. I'll simply jump to the aspects which I think are not as well covered. So first is the energy that you bring into the room when you come in and introduce yourself to the patient. The energy has to be congruent with the seriousness or the gravity of the conversation that you're going to have with this patient. Now consider this introduction. Hi, my name is Sal. I'm one of the doctors. I'm going to be updating you about your treatment. If you bring this bright, positive energy into the room and then go on to give them devastating news, it creates a disconnect that feels awkward and out of place. And now, I don't mean to bring a rain cloud with you into the room when you come in, but the energy that you bring in should reflect the gravity of the conversation and the situation. Now take this for example. Hello, my name is Sal. I'm one of the doctors that's looking after you. And I think it's important that we have a conversation just now about what's been going on so far and what I think is going to happen moving forward. And now this tone, if done correctly, will also serve as a warning shot to the patient and also prepare them psychologically, subconsciously for the difficult conversation that's going to come. Now the second point is to always have a nurse come in with you to have these conversations, even if it's an auxiliary nurse or a care support worker. If the patient has got a next of kin or relatives that have already been updated beforehand and are willing to come in when you're speaking to the patient, this is going to be an added bonus. Now the reason for this is that once I've had this conversation with the patient and leave the room, I do not want the patient to be left by themselves. I want them to have emotional support after giving that heavy news. So once you've left the room, the nurse that's accompanied you can remain in the room to support the patient, whether it means staying in the room for a bit longer or phoning the patient's relatives on the patient's behalf so that the relatives can be with the patient during this difficult time. If the relatives are already present during the conversation, then you can step out of the room after the conversation, giving the patient a private moment to be with the relatives. Now the third and final point for this video is about emotional detachment, a concept that I think is often misunderstood in medicine. Many believe emotional detachment to mean feeling no emotions at all during these difficult situations. Unfortunately, this approach has sometimes led to doctors delivering devastating news in flat, disconnected, and dispassionate manner. I do not believe that this is the right approach. Compassion is absolutely essential in these conversations. It is often natural to feel grief alongside the patients and relatives. After all, it is a human response to their profound loss. However, what's equally important is how we manage these emotions afterwards. Once I've spoken to the patient and their family, I make a conscious effort to compartmentalize the event as well as the emotions that it brought up. This allows me to move forward and continue providing care to my other patients without being overwhelmed. And it's essential to also understand that this is not about moving on, but about moving forward. I see this skill, compartmentalization, as what emotional detachment should truly mean. For some, it might come quite naturally, but for others, it might require deliberate practice and reflection. But it is an important skill to have because it allows us to honor and acknowledge the grief that our patients and their relatives are feeling, whilst maintaining the emotional resilience in order to maintain care for other patients. Having compassion is absolutely vital when it comes to breaking bad news. It's what distinguishes a doctor who merely delivers bad news from one who fosters a genuine human connection with the patients and relatives during such devastating times. These 3 points are a few of many factors that are important to consider when breaking bad news. If you want to learn my rapid 5-step process for assessing someone's airway like a pro, watch this video. I hope that helps.